Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, we will talk about the coronary vasculature. Coronary circulation means that the blood pumps from the heart to the heart and back to the heart. The blood forces to the heart through the coronary arteries. Deoxygenated blood returns back to the heart through the cardiac veins. Coronary arteries supply the myocardium of the heart without sufficient overlap or anastomosis. So the coronary arteries are called the end arteries. We have two coronary arteries that arise from the aorta. Right and left coronary arteries. Both arteries fill during diastole of the heart. The blood passes through the coronary arteries, supplying all the tissues of the heart, including myocardium and epicardium. The deoxygenated blood or the waste products returns back through the cardiac veins to the right atrium of the heart. This is the superior view of the heart, the anterior, right, posterior, and left aspects. We can see here the aortic sinuses, which are three dilatations above the aortic valve at the beginning of the ascending aorta. We have anterior aortic sinus and two posterior aortic sinuses. The right coronary artery originates from the anterior aortic sinus, but the left coronary artery originates from the left posterior aortic sinus. Here we can see the anterior and posterior aspects of the heart and the attached great vessels. This is the coronary groove or coronary sulcus, which separates both atria from both ventricle. The right atrium, the left atrium, right ventricle, and the left ventricle. Also, this is the anterior interventricular groove that separates the right ventricle from the left ventricle. From the posterior aspect, we have here, this is the coronary groove or the coronary sulcus. This is the left atrium with pulmonary veins. This is the posterior interventricular groove, which separates the right ventricle from the left ventricle. Also, we have here the pulmonary trunk, two pulmonary arteries, ascending aorta, arch of aorta, superior and inferior vena cava. This is the superior vena cava. This is the superior vena cava, and this is the inferior vena cava. The right coronary artery, as we said before, arises from the anterior aortic sinus, passes between the pulmonary trunk and the right auricle, descends vertically in the coronary groove, then winds posteriorly around the heart, appear in the posterior part of the coronary groove, gives terminal branches that anastomose with the branches of the left coronary artery. It gives multiple branches. The first is the right conus artery that supply the front of the pulmonary conus or pulmonary infundibulum. Many anterior and posterior ventricular branches to the right ventricle. This is the anterior ventricular branches. The largest one is called the marginal artery. The marginal artery passing along the lower margin of the heart, reaching the apex. It is also called acute marginal artery. The posterior ventricular branches again supply the posterior aspect of the right ventricle. Along the course of the right coronary, in the posterior part of the coronary groove, it gives a large branch called posterior interventricular artery. The posterior interventricular artery passing in the posterior interventricular groove. It is also named the posterior descending artery. It gives the branch called the atrioventricular nodal branch that supply the AV node, one of the conducting system of the heart. Also, the right coronary artery gives atrial branches supplying the anterior and posterior aspects of the right atrium. One of these branches is called sinoatrial nodal branch that supplies the SA node or the pacemaker of the heart. Collectively, the right coronary artery gives the anterior conus, anterior and posterior ventricular arteries, posterior interventricular artery, and atrial arteries. The left coronary artery arises from the left posterior aortic sinus, passes between the pulmonary trunk and the left auricle for a short stem that bifurcates into two large branches, anterior interventricular branch and circumflex branch. The anterior interventricular branch is also called the anterior descending artery, passes in the anterior interventricular groove, then winds around the apex of the heart. In most cases, it anastomoses with the posterior interventricular artery. Along its course, it gives the left conus branch to the pulmonary conus or pulmonary infundibulum, gives multiple ventricular branches for the adjacent sides of the right and left ventricles. Also, it gives a very important septal branch, supplies most of the interventricular septum, leaving the posterior part of the septum to be supplied by the septal branch of the posterior interventricular artery. The circumflex artery winds around the left margin of the heart to appear in the posterior part of the coronary groove. It gives atrial branches to the left atrium, supplies both sides of the left atrium, gives also anterior and posterior ventricular branches, supplying the anterior and posterior surfaces of the left ventricle. One of the ventricular branches is large and is called the left marginal artery that passes along the left margin of the heart to supply it till the apex. Collectively, the left coronary artery gives atrial branches to the left atrium, ventricular branches for both sides of the left ventricle, including the left margin and the apex of the heart. Here we can see the variations in the coronary arteries. Most of the variations affecting the blood supply of the diaphragmatic surface of both ventricles. The origin, size, and distribution of the posterior interventricular artery are variable. We have right dominance and left dominance. In right dominance, the posterior interventricular artery arises as a branch from the right coronary. and this occurs in most individuals, about 90% of individuals. In the left dominance, the posterior interventricular artery arises as a branch of the circumflex artery, from the left coronary, and this occurs only in 10% of individuals. Coronary circulation means that the blood pumps from the heart to the heart and back to the heart. The blood forces to the heart through the coronary arteries. Deoxygenated blood returns back to the heart through the cardiac veins. Coronary arteries supply the myocardium of the heart without sufficient overlap or anastomosis, so the coronary arteries are called the end arteries.